Well, welcome everyone, and thank you for joining us here for the special World IBD Day conversation. My name is Adam Cook, and I'm a member of the Crohn's and Colitis Foundation's National Council of College Leaders. On behalf of the Council, we are excited to be hosting this important discussion. Around the world, more than 10 million people live with inflammatory bowel disease, also known as IBD, and countless others are affected by the disease's impact on their loved ones. And as we all know, these diseases affect everyone, regardless of race, gender, sexual orientation, or ethnicity. In honor of World IBD Day, we wanted to discuss how one's racial or ethnic background has had an impact on their disease journey. I'm excited to be joined today by three incredible members of the IBD community. Dr. Meena Bewtra, a gastroenterologist at the University of Pennsylvania, a member of the Foundation's National Board of Trustees, and an IBD patient herself. Stephanie Stinson, an IBD patient from Georgia, and Anand Omprakash, an IBD caregiver from New York. Without further ado, let's jump right into conversation. Dr. Bewtra, can you share what we currently know about how IBD impacts racial and ethnic minorities differently? How prevalent is IBD among racial and ethnic minorities? Do the diseases present differently among these patients?
So thanks so much for the question. First of all, thank you so much for having me and for hosting this. This is such an important topic. So we actually are learning a lot about racial and ethnic differences in inflammatory bowel disease, or IBD, and we do know that there are significant differences among the various racial and ethnic groups. So to give a little background, IBD has historically been a disease of white Europeans, and this is reflected in most national studies. The majority of patients, if you look, are going to be what are called Caucasian. However, we are seeing much higher numbers of new patients from different ethnic and racial groups. And I'm going to use some terms here that I want to make sure everyone understands. So prevalence means the number of people who already exist with IBD. So prevalent patients are patients we already know about. And among prevalent patients, patients with the white European backgrounds are the most common. Incidence refers to the new patients, the number of new patients with IBD that we diagnose. So for example, there was a study from the United Kingdom last year that found the rate of newly diagnosed overall inflammatory bowel disease was higher among people of Indian and Pakistani descent than white European patients. And in another study here in the United States between 1970 and 2010, they found that while the incidence, again, the number of new patients among what were called whites increased by 39%, the incidence among non-whites increased by 134%. And a recent study from Latin America and the Caribbean has found the incidence and, of course, the prevalence of inflammatory bowel disease increasing among those regions as well. So this gives you a little bit of taste of the differences we're seeing in new patients. But we've also found that different ethnic and racial groups have different severities of disease. So, for example, there's a very recent study from Korea that found among their pediatric population, Korean children were much more likely to have perianal fistulas and abscesses than their European pediatric counterparts. And there have been several studies that have found that African Americans are more likely to have complications at baseline and during follow-up, including postoperatively, than non-African American patients, and more likely to get hospitalized and have longer hospitalization stays. So all of these findings are important for us as we're seeing these new ethnically and racially diverse patients.
Great, thank you very much. The next question is for Stephanie. As a patient yourself, can you share with us what challenges you have faced as an African-American IBD patient?
Oh, absolutely. First of all, let me thank you guys for inviting me to be a panelist as well. As an African-American dealing with Crohn's disease, I've faced, just like Dr. Bewtra said, some of the challenges of being diagnosed. I can remember having symptoms as early as the age of 17, but not being diagnosed until 22. And those symptoms were pretty severe. So my disease had really progressed quite a bit by the time I was diagnosed. Some of the other issues is, of course, education. awareness and socioeconomic issues. And under that umbrella of socioeconomic issues are the precipitations of income and affordable health care, access to good doctors. One of my first doctors, I can say, I went to a general surgeon for my procedure, which did not end well at all. A bowel resection that should have taken only a few hours lasted in excess of 12 hours. So there were major complications, even to the point where I was on a high dosage of steroids at my first surgery, and I wasn't tapered off before surgery. So a day after being released from the hospital, I had to be rushed back in for emergency surgery because I had developed sepsis, where, of course, you guys know what happened. But yes, so those are some of the complications and challenges that I faced, as well as not ever having heard of Crohn's before I was diagnosed. So I didn't have anyone that I could speak to, anyone that was aware of Crohn's in my family or in my community, period. So that was a big barrier there with some of the challenges that I faced initially. So again, my disease had progressed quite drastically by the time I realized that I had Crohn's. So.
Okay, well, thank you very much for sharing your experiences with us, Stephanie. Moving on, Anand, can you speak to some of the cultural challenges both you and your wife, Tina, have faced as you navigated through her disease journey?
Sure, of course. And first of all, thank you guys for having me on. I think it's a really important forum for us to be able to share our experiences and educate those who might benefit from our, talking about the situations. Now, with regards to my journey and my community, I think there's a lot of stigma around chronic illness in my community, especially when it comes to marriage. Part of that is the fact that marriage is seen traditionally as a contract where one person is earning, for example, and the other person is rearing children or taking care of the household. It's not seen as first and foremost a way to provide companionship, which is how I view it to be. And as a result, I've faced scrutiny myself as to why I married Tina, because of her illness, and she herself has faced her own scrutiny because people have questioned, how did you get married when you have Crohn's disease, which is really unfortunate. So I would say all in all, it's been kind of a difficult journey, but I have to emphasize that companionship is really ultimately what keeps a marriage afloat, and facing these challenges together has helped us grow stronger in the process.
Thank you. Dr. Bewtra, the foundation received funding from the Centers for Disease Control Prevention in its input study. Can you tell us a little bit about that study?
Absolutely. So the input study, which stands for incidence, prevalence, which I just explained, so everyone knows now. So incidence, prevalence, treatment, and outcomes in patients with IBD, input, is a 5-year study. It's funded by the Centers for Disease Control, or the CDC. And the goals are to estimate the incidence and prevalence of both Crohn's disease and ulcerative colitis in both the adult and pediatric populations in white and non-white minority populations. It also looks to determine whether race or other factors, such as access to a large IBD clinic or a large IBD practice, are associated with differences in care and treatment. And hopefully, as a result of these findings, we can therefore identify strategies to improve disease outcomes among all of our populations of IBD patients. So input is going to be created using 2 of the Crohn's and Colitis Foundation's existing infrastructure. So IBD Plexus, which is an integrated network of adult IBD patient populations, and the Improve Care Now registry of pediatric IBD patients. So it's a fantastic initiative to define and provide the tools to address a lot of the differences in care across race in both our adult and pediatric patients, some of which, for example, were exemplified by Stephanie's story.
All right, thank you. And the next question is for all 3 of you. How do you feel that being a minority has impacted your perspective or outlook on your disease?
I'll let Stephanie and Anna go first.
Okay, I'll take that. Being a minority with Crohn's disease has impacted my perspective heavily. Again, being the first one to ever be diagnosed was a challenge. Like I said, I didn't have anyone to look to. Secondly, I think that for minorities, or myself in African American community, we tend to not speak about our illnesses as if they were some type of badge of weakness. So there was a taboo about talking. So that led to isolation, that led to trying to will your way through an illness as opposed to properly being treated for the illness. And it led to a delay in acceptance because for a lot of chronic illnesses, the first line of defense is to accept that there is something wrong and that this something wrong has no cure. So there's going to be a lifetime of treatment. And that was hard for me to initially wrap my head around. It was hard for me, my family, to wrap their heads around because, again, you look fine on the outside and your insides are just,
Yep.
eating away, literally hating your guts. And you have the stigma of being lazy because no one understands what you're truly going through. So that played a lot into it, as well as, again, the financial aspect of it, which weighs so very heavily. Initially, when I was diagnosed, I was diagnosed at 22. I was on my mother's insurance. As soon as I graduated college, I was dropped. So I had no health care insurance. And until I found employment, there was about 3 months of lapse time. And then the pre-existing condition clause came in. So there was another 6 months of lapse without any treatment, which led to, again, progression of my disease. So being that perspective of being African American, the socioeconomic impacts, your community not knowing, ever having heard of this disease really weighs heavily on you to even speak about it, to get treatment about it, to find the proper care, education, and a source of community and support.
I'd say from my side, being of South Asian descent, many of the people in my community view alternative medicine as a critical part of the healing journey. And in fact, a lot of us rely so heavily on that it's to the detriment of traditional allopathic medicine, which, in my opinion, is actually dangerous at times. I think both kinds of modalities have their place in the healing process, but you can't do one while ignoring the other. And we made this mistake actually early on in Tina's healing journey. She was prescribed a biologic drug that had a really scary name, and we were terrified of using it. So rather than taking the doctor's advice and just using the medicine, we tried all kinds of other routes, naturopath, Ayurveda, and, even homeopathy. None of them were able to get the disease under control. And ultimately, we ended up doing the biologic drug, but it was too late at that point for it to be as efficacious as it could have been, and she had to actually have emergent surgery. So I would say, from my perspective, it's really important to listen to your doctor, take their advice. They really do care, and they have your best interest in mind, and it's important to tackle these problems before they get out of hand.
So from my perspective, I think being a minority has been both a potential positive and a potential negative. So like Anna had mentioned, there was tremendous concern from my now husband about him dating me. To be fair, we'd only been dating for 6 months when I was diagnosed, and for about a year when I became hospitalized and nearly died from my IBD. But in Indian terms, every date is a potential marriage. So of course, his family was very concerned about him being with me. And, I could understand that. I think any family is worried about the happiness and the future of their child. And there is, as Anna had mentioned, so much stigma with illness and the chronically ill, and is this a life partner, and is this somebody who's suitable to have a family, and all of this. And to his credit, he saw past all of that to, you know, we're a team and we're going to be in this together. And I really have given him a lot of credit. On the positive, and bear with me here, I am that typical A personality raised in a typical type A Indian household where parents always ask their children, isn't a Nobel Prize just, is that too much to ask from your child? And so actually both my parents are doctors, and they were so supportive of me when I became sick. I mean, they were far more relaxed about whatever my choices were after I was diagnosed with IBD than they were before. But I was really depressed. I, much like Stephanie, I'd been a first year MD PhD student. I went from that to being unable to eat, unable to walk. I was blind in one eye. I was being fed through an IV tube. I'd lost my health insurance. And I think that type A personality that was instilled in me got me really angry. It moved me from the depressed to the angry category. And I thought, you know what? I had a plan. I was going to be a doctor, and I'm going to go back to that plan one way or the other. I got to check that box on my list. I can't live with myself if I don't check the box off. And it kind of pushed me to realize something I try to tell my patients all the time, which is, this is, as Stephanie said, this is a disease of a lifetime. We don't have a cure, and we're trying really hard, but it is one part of you. And you are so much more than this and can do what you want to do. And our goal is to try to get you there. And so in a way, that whole type A personality that, you know, I had been raised with kind of helped me a little bit, because I was very, very depressed, and there wasn't a lot of support and a lot of people to reach out to. And so it was very difficult.
Well, thank you all for sharing. And we actually have another question for all of you. What tips do you have to help minority patients become partners in their IBD care?
Well, for me personally, educate, educate, educate. I cannot stress that enough. Go and learn as much as you can about your disease. And you have to go in with the mindset that I have to be my biggest advocate. Nobody knows me better than I know myself. So when you go in with a knowledge of your disease, even if it's just a tad bit of knowledge, but with an open mind of learning more and allowing the doctor and yourself to concert with each other in your treatment, then collaborate, then you guys are a better team. I found that I've had a few doctors in my experience being a minority that didn't quite listen to my symptoms. Initially, it made me feel like it was in my head. So I had to press upon them that I know my body, something's not right. And I didn't have a problem with saying, I don't think this relationship is going to work. So, you know, no offense to you, but I think I need to seek, you know, other advice. And I think that for us, if we don't arm ourselves with that knowledge, we go in blind, not knowing what to expect. And eventually that gets to a point of hopelessness that I initially suffered from. So I said, equip yourself with knowledge as well as your support system. Allow them to know what is going on. Bring them into the folds of your illness so they can better understand what you're going through as well, and be better to help in supporting you.
I'd say from my side, you know, as a caregiver, really just be a partner in your spouse's care. You know, show up to their appointments, understand the ins and outs of the disease, research the potential treatment options, and definitely don't do something like shun the treatment by just saying, oh, you know, this is your fault because it's a lifestyle or dietary choice. I can't tell you how many people have told Tina that over the years, that, oh, maybe you just didn't eat the right foods, you didn't take care of yourself, this is why you have the disease. Don't do anything like that. Be supportive, you know, get to know the doctor, get to know, you know, educate yourself, like Stephanie was saying, and, you know, be a part of the process, be a part of the decision-making process on the care.
I would echo absolutely everything that Anna and Stephanie have said. And a lot of the advice I give to IBD patients is no different whether they are from a minority or a different racial group. But the first is, like they said, educate themselves and don't be afraid to ask questions. And actually, I think a lot of patients forget the questions when they get into the office, so write them down. I love it when my patients open up their phones now. It used to be paper, now it's all on the phone, but write them down. And be careful though, there's a lot of misinformation out there. Please go to credible sources. That misinformation can be really dangerous sometimes for some people. And I just want to stress that. Also, don't assume that your physician understands the various pressures, stresses, and worries that are unique to your particular racial or ethnic group. Tell us about them. We learn from our patients, and we're not all the same race, we're not all the same background, we don't all come from the same socioeconomic status. If you're not telling us our worries, we don't know how to address your concerns. We don't know how to give you the answers to make you feel more confident with your disease. I also think finding peer support is important. Find people, like Anand said, in your culture, in your society, who see you as a person, not a disease, because this can help you with accepting treatment decisions that may be difficult or even at odds with what somebody in your house or in your society might say. And finally, especially for younger folks, find somebody who looks like you. There's a lot of bullying in our current culture. I see a lot of my younger patients who were bullied when they were kids because the medicine made them look different, or the disease made them have an accident, or maybe they had to have surgery. And they, especially in our younger patients, they might lack an extended independent group of friends or peers. So finding a buddy, even if it's someone who's a little older, who can be a big brother or big sister, can be helpful in having them navigate the ups and downs of their IBD and being able to stand and advocate for themselves with their doctor, with their parents, with their school, whatever it is.
Thank you all very much. As an IBD patient myself, I'm really appreciative of hearing all this advice. But now I guess towards the opposite end of the spectrum with physicians, Dr. Bewtra, what can physicians do to further understand the needs of minority patients?
Well, there are definitely a few things. So first of all, for better or for worse, and I'd like to think it's for the better, physicians tend to be a very evidence-based driven group. So having studies like the input study, having that evidence of the impact of differences of race in IBD or ethnicity on IBD helps us, because studies that have shown us that one particular group tends to have longer hospitalizations, tends to have more severe, more aggressive disease, helps us remember this and remind ourselves to be more careful with these patients, to maybe take a little bit of extra precautions, be a little bit more aggressive with how we're watching them, monitoring them, etc. And so even if we don't see these issues in our everyday practice, we are aware of them, and that's really important. Second, just like I have said that patients need to speak up about their specific concerns, we need to ask as well. And this is hard because sometimes we don't want to offend people by assuming something about them, but sometimes just asking a question like, are you worried about something? Is there something you want to talk to me about? That opens the door to have that conversation. And then, And then finally, having more public advocates is a huge help. I often refer my patients to various advocates that I know that are out there on social media, because sometimes people find it easier to confide in someone who's outside of their personal circle but has firsthand knowledge about what they're experiencing. And then I think that one of the last things is understand that the concerns of the caregivers and the family have a huge influence on patients. So while my patient is my primary concern, and I'm going to also try and phrase my information so that my patient can take it back to their spouse, they can take it back to their parents, they can take it back to their significant others. So I can try and make my patient empowered to discuss the concerns that they might face outside of my clinic office. So for example, all my patients of childbearing age, regardless of whether they ask, I'll say, hey, your medications are safe for you to be on when you become pregnant, if you want to become pregnant, if you're thinking about that. For my patients who are in school, I'll discuss that it's safe for them to go to college. It's safe for them to go to graduate school. For my patients who travel a lot, hey, we can totally make this work with this medication and any travel plans. Just giving the patients the tools to feel confident in their discussions outside of the office visit, so that they're empowered. And so you're indirectly addressing these other concerns that they might face.
Thank you. And Stephanie and Anand, How has connecting with other minority patients and caregivers impact your perspective on IBD?
Okay, for me, it has been a wonderful experience connecting with other minorities. Um, Again, when I was diagnosed, I didn't see anyone that looked like me. So and I was told that it was a Caucasian European disease. So, why do I have it? But so it was really, really hard finding anyone for years. And again, I was diagnosed back in the ancient years of 1992. So, that was really difficult. We didn't have the social media or anything. So I didn't have that connection. But now that I have equipped myself and empowered myself to get out there and share my story, I'm finding that even just talking about it, people may not know it by name, but, oh, I think my mom or someone has that. Oh, I think I've heard that word before. So just bringing awareness. And the way that it has impacted my family as caregivers, my entire family supports me. I don't know where I would be without my core group right now. And I really, really commend you. I lost my marriage over Crohn's disease. And it was at the thick of when I had to be placed on disability and couldn't work, and my identity was snatched because it was attached to my profession. And now I'm looking like, who am I now? And then my marriage falls apart and I'm like, oh, I really don't know who I am now. So I really hit rock bottom and had to realize that I had to dig within myself, equip myself, arm myself, and get back out there. There was so much to be said, be learned, be shared about my journey with Crohn's disease. And if anything, if nothing else, if I just impact one person, especially someone, brown or black, or someone with kinky curly hair that can see me and say, oh, she's living with all of the issues, even the extra intestinal issues that I face, all the perianal issues, all of that, and say, she's surviving, she's fighting, she's a warrior. I too can do this. So I think that it has been amazing connecting with other patients and caregivers, because again, my family would tell you, they can call me and I'll say, okay, we know, all right, we're on our way, or let's leave her alone. Or they know me now, so they know my body language, they know when I'm not feeling well, all of that. And again, a core group of friends. But connecting just makes me understand that I'm not alone and that we have to support each other.
So from my side, it might sound a little shocking, but I've actually yet to meet another minority spouse caregiver in my age group, which is part of the reason why I wanted to share my experiences today. I really want to show people that they can have happy, prosperous marriages, even with an IBD condition. And, there's going to be adjustments that you'll have to make in the process, but that goes for every relationship. No matter what you're dealing with, you're always going to have to make adjustments in any kind of marriage or relationship. And that's just part of life. That's just part of the process. But that shouldn't detract you from connecting with someone who you are potentially very compatible with. I know from my own personal experience, I met a lot of people before Tina, and I think I would much rather be with someone who I truly cared for and connected with and was truly compatible with, who had, Crohn's disease, than someone who I wasn't compatible with, who was completely healthy and who I was totally miserable with. I think that's just, I think I wouldn't call that common sense, but I think that's just something we should all be mindful of. And so, I've met a lot of Tina's non-minority friends and their spouses who have IBD, and even though they're not minority caregivers, it gives me hope and belief that minority caregivers will follow that route at some point, and I'd like to see that change come about.
Very well, thank you both. Let's close with this question for all of you. Why do you think it's important for minorities to share their IBD experiences?
To break the stigma, to show them that it's possible to have a full life, have loving partners, that the stigma surrounding chronic illnesses don't have to define them, that, all of the above. I really just want our messages to hit home and allow people to really consider someone with IBD as a good partner for them.
For me, it is extremely important. Again, you feel as you're not alone. The isolation is horrific. So if we can break that stigma and take care of not just body, mind, and spirit, because they all flow and work together. So if we can take care of that by sharing our story and allowing others to see that we have this illness, but the illness doesn't have us. And I like to say that the one thing that we sit on and try and suppress is probably the one thing that we should be carrying around. And what I mean by that is I tried to suppress my illness. I tried to suppress speaking about it. I tried to sit on it and not share. But this was probably the one thing that purposed me and propelled me into who I am now, how I see life, how I appreciate life, how I am intentionally grateful about the life that I do have, even with Crohn's, the gratefulness about my family and friends and supportive system. So I would share my story with anyone that would listen, and even those that get tired, I share, because that right there just exposes and brings awareness to this disease that we need to put a face to. I am that face. You're that face. So we all share that commonality that we can speak on and share shared experiences with one another and get through this. So that's why I share, because I care.
So I will say that the one common thing that I hear from all my patients, that I hear from everyone that I know that has this disease, is that it is an incredibly isolating disease. It makes the person who has it feel very alone. It's not something we normally talk about. Blood in your stool, diarrhea, accidents are not common topics of conversation. And so people feel very alone. Even if they say that they have this disease, they may not really talk about it with somebody. And for some of my patients, I think just being able to talk about it with somebody is a burden off of them. So I really want to thank Stephanie and Anand for speaking here today, because I think the answer to why it's important for minorities to share their experience is exemplified by both of them. A patient can look at them, they can hear their story, it can resonate with them in a way that they may not have heard anyone else yet. And they might say, oh yeah, that's me. That's happened to me, and I can relate to that. And it's like a weight that's taken off of patients when they can suddenly share that experience with somebody else. And I want to say to every patient, I urge you, just like Stephanie and Anna had said, to speak up and become an advocate for your own experience. You may not even know whose life you impact, but you do absolutely make a difference. You may never hear about it, but your story will impact somebody who says, hey, they look like me, they sound like me, they've had the same experience as me, or my spouse or my girlfriend is going through this, and I understand. And that makes people feel less alone with this.
Well, that's all the time we have. I want to give a big thank you to Dr. Bewtra, Stephanie, and Anand for sharing their experience and knowledge with us today. It is not too late to step up for World IBD Day. There are lots of ways you can get involved, from creating personal infographics to making a donation to reading IBD stories and more. Visit www.crohnscolitisfoundation.org/World IBD Day to get involved. We hope you're all staying safe and healthy during these difficult times. Thank you.
Thank you.
Thank you.
Thank you.